Under the auspices of His Excellency Abdel Fattah el-Sisi, President of the Arab Republic of Egypt, the third Africa Health ExCon was held in Cairo, Egypt, from 3rd to 6th June 2024, under the theme Bringing Together All Healthcare Representatives Annually Under One Common Roof.
So a lot of structural change must happen in African countries to be able to make the health sector attractive again for our workers to come back or for those that we are bringing up to stay in those sectors. Now, so the first thing we need is that there must be political will. If Africa's political leaders do not show with action, not by words, that healthcare is their number one priority for the well-being of the society, it will be very difficult to reverse the brain drain. So political will is very, very important. African countries must prioritize healthcare because a state does not exist a state exists to enable the welfare of its citizens. A state does not exist just for its citizens to survive. A state exists for its citizens to thrive.
The Africa Health ExCon series is arguably the biggest international exhibition in Africa that gathers worldwide pharmaceutical and medical manufacturers all in one place, the Egypt International Exhibition Center. Leading up to the billing, the conference was attended by thousands of health personnel, experts and industry players worldwide, attesting to the participation of the second edition in 2023, which drew over 43,000 attendees.
In terms of the solutions, so how can the taking health workforce as a science and evidence, how can you support the solutions? I'm not saying that we should not call for political commitment. This is a hallmark of the matter and is important. But I think if we are short of, reaching that true political commitment, we have also to come up with innovations. And the only way to come up with innovations is to address it from the science perspective. I will give 3 examples. One example is if we are talking about the health workforce problems nowadays, I do believe that shortages is one major problem. And this has been shown by Jim Campbell in his presentation, where the world is lacking over 18 million health workers, 6.1 million only in the African continent, and that's a huge figure, up to 2030. So training and education is a major solution, and this has been noted by other panelists. So in scaling up education of health professionals, we are not only increasing the numbers of graduates.
It was hosted by the Egyptian Authority for Unified Procurement, Medical Supply and the Management of Medical Technology, UPA, in collaboration with Global Conference Management, GCM, an Egyptian company that aims to create Egypt as the ultimate destination for international meetings, conferences, and exhibitions. The AAU was represented by the coordinator of the North African Regional Office, based in Egypt, Professor Amani Al-Sharif, who also doubled as a member of the steering committee of the Africa Health ExCon, and Mr. Ransford Bequin, the Partnerships Manager at the AAU Secretariat in Accra.
Are our countries in the position to actually provide salaries and working conditions for healthcare professionals that are comparable? What other interventions could there be? So one, we have heard about the fact that we could train more, like Cuba. Cuba trained more of their health professionals and they supply them to different countries. But this would require a lot of investment into training more. But the other side of this is that even where we train more, what caliber of health professionals do the receiving countries require?
The conference was a blend of presentations and exhibitions. Delegates were welcomed to a grand and colorful opening ceremony on 3rd June 2024. The opening ceremony was followed by 3 days of insightful presentations, and the exhibitions were state-of-the-art in nature. Many partnerships were brokered, renewed, and strengthened during informal meetings over lunch and dinners. There was also the social aspect of the conference. The special gala dinner held over the intriguing sight and sound display at the Gaza Pyramids on Wednesday, 5th June 2024. The Africa Health ExCon has come to stay. Participants have committed to moving into autopilot mode by implementing action-oriented and pragmatic solutions to solve Africa's health challenges. There is a high expectation of results in the 4th edition in 2025, which will be jointly organized by the UPA in collaboration with the GCM and the Africa Centers for Disease Control and Prevention, Africa CDC, a public health agency of the African Union that supports the health initiatives of member states and strengthens the capacity of their health institutions to deal with disease threats.
Good evening. Today we are celebrating this agenda of local manufacturing is the second independence of Africa. Because the day we'll start to manufacture our own product, to use our own product, to build our economies while we are ensuring our health security, you will see the difference that it will bring to the development of all African countries. This is why the General is right to tell you that 2 days ago we made it clear and loud, saying that the next edition will be co-hosted by Africa CDC and the UPA. And that one, it will help us to bring more people, even to bring head of states, to bring many ministers, and to bring so many leaders. I think General will look for space because you will have so many people coming here. Why we want to co-host? It's not just because we want to organize an event. No. Africa Health ExCon will become the opportunity that Africa will start to monitor the progress that we'll make on the agenda of local manufacturing. Each country will have opportunity to tell us what they are manufacturing and what they are buying from other African countries. It will become opportunity for Africa also, because we are not just manufacturing for Africa, we'll also export to other continents. It will be opportunity for us to assess the progress we'll make on that. We have a market of 1.4 billion people. Let us use this power that we have. No one must convince you that we don't have market. We have a strong market. Even in 2040, our population can be around 2.5 billion people. This is the strongest market that we are creating in the world. I believe at that time when we'll stop, because I know my brother will still be there. I know our leader, President Sisi, who initiated this Africa Health ExCon, will still be there. I want them to say, we built something unbelievable. And I want our children, when they will come, to say, thanks that you gave us a strong legacy.
Egypt will never cease to intrigue the world with its history, magnificence, and leadership in several continental agenda.
Appreciation to GCM, the company organized Africa ExCon. I want to remember Mr. Sharif Salim, who started with us the first edition and second edition. To my colleagues in UBA, my thanks to Dr. Kamal Abeid and his committee.